Good morning, everybody, and welcome to our Medicare Made Easy. This is a regular Facebook live broadcast that Blue Cross and Blue Shield puts on, and it is about health topics for our beneficiaries that are either new to Medicare or turning 65 in the future. My name is Deborah Smith, and I am a Medicare benefit specialist for Blue Cross, and with me is my colleague, Ann Booth. Hey, Ann.
Hey, Deborah. I'm so glad to be here with you today. And I'm also a Medicare benefits specialist with Blue Cross. As Deborah said, this broadcast is to share important health information and tips with people on Medicare plans because, it can get so confusing. But we're going to make this so easy for you all, and you'll walk away with so many great information and tips. And so for those who are on Medicare, we have some very important dates coming up. The annual enrollment period is right around the corner. I can't believe it. It's already here. This year has flown by. And so the Medicare annual enrollment period for 2022 health plans starts on October 15th and runs through December 7th. And during this annual enrollment period, anyone on Medicare can choose a plan or make coverage changes. So coverage on the plan you choose will start on January 1st of 2022. So today, Deborah and I are going to share some tips to help you to learn more about your coverage options and pick the plan that is the best and it fits for you. Because a lot of people, they talk to their friends and family. Deborah and I, we talk to a lot of people all the time, but what is right for your friend, your husband, your wife, or your spouse might not be the best one for you. So you'll be able to start seeing more information about available health plans on October 1st. And this is a date when insurance companies can begin sharing information about their plan options for the upcoming year.
All right, thanks, Ann. Now we're going to get right into the sauce. But before we get started, I definitely want to let you know that please drop us a thumbs up or a little smile emoji to let us know that you're listening. And we will answer your questions. So definitely drop those in the chat as well. And we will definitely get to all of those or as many as we can. And if not, we will answer them even after the broadcast. So before we get started, the one item that we really like to talk about is, how confusing Medicare can be. We definitely know that that's the case, but, that's what we're here for, to kind of make it an easier transition for you. And we know how hard it is to make decisions for family members or even for your parents or anybody else, but it really doesn't have to be confusing. You have a lot of resources for you, and that's what Ann and I are going to help you with today. So let's just start with some basics about Medicare. Who qualifies for Medicare? First of all, Medicare is a health insurance program that can cover people that are 65 and older, some people that are younger because they may qualify because of a disability or a specific illness. So it depends on your particular situation, but typically you age in at 65. We're going to talk about that a little bit. And of course, we're also going to talk about the different parts of Medicare. So we're going to get into what I call the alphabet soup, the A's, B's, and C's, and D's of Medicare, as you can see up on your screen now. So of course, Original Medicare is a federal government run program. It offers Part A, which is for hospital, and Part B. These items cover for hospital, doctors, among like lab services and things like that. So just like the basics and the foundation of Medicare. Now, of course, you have the challenge is because Original Medicare only covers a percentage of the cost. So you're still left with deductibles and 20% of the amount. So that's where different options come in to kind of help you offset these costs. And then, of course, Original Medicare does not cover prescription drug coverage, which is called Part D for drugs. You will also have to getting tongue-tied here. You will also have to purchase possibly a standalone plan. But of course, there are some options that we're going to get into next here for you. And of course, if you have any questions as I'm going through these pretty quickly, just let me know. Now, another choice that you can have is you can either choose a supplement, and do the a la carte style and have a drug plan separately, or you can also choose what's called a Medicare Advantage plan, also known as Part C. And these plans are offered through private companies like Blue Cross. With a Medicare Advantage plan, you're going to get all of the parts that Medicare covers, and you're also going to get some extra benefits such as vision, dental, fitness, and much more. And so those are really kind of like a package deal and a little easier to use.
Yep. So great information, Deborah. And so I know that may sound like a lot of letters, but the important thing to keep in mind is not to get overwhelmed by your Medicare choices. We have several ways to help you learn more about your choices. So first, we'll be hosting this, it's called Medicare Made Easy. And we do Facebook Live series monthly throughout the annual enrollment period to make this more understanding and easy for you. So Medicare beneficiaries or their family members can tune in for these events to get your healthcare coverage questions answered by our Medicare experts. And if you miss the events live, we'll post video recordings of each one here on our Facebook page or on our Blue Cross YouTube channel. And speaking of our YouTube channel, we've got a Medicare Made Easy YouTube playlist with short videos from in-house experts. And you can see this right here on the screen, including a Medicare 101 video. And that's great information. And the Blue Cross and Blue Shield of Louisiana YouTube channel also has videos about various health topics from our clinical team. Also, Medicare beneficiaries can get help for you from Blue Cross experts who can answer your questions and help find a plan that best fits your needs. Also, you can contact Deborah and I, or we have other Medicare benefit specialists. So you can call 1-800-568-1417, or we have a website that you can go to. It's bcbsla.com/Medicare, and that's on your screen, and it'll connect you with one of our Medicare experts. And it doesn't cost you anything to work with one of our agents, and there's no obligation to enroll. And Deborah, over to you.
Thank you, Ann. All right. Well, we did get a question in the chat, which was great because I was just about to go into some of the questions that we received. So the question that we received is that they just received Medicare from their husband's plan, and they're not originally from this country. So they're trying to find out of several plans, which one they should choose that will cover foreign travel. My recommendation is to reach out to these organizations and find out if they specifically do. In this educational seminar, we are not able to go into specific details about individual plans, but I can tell you that original Medicare only covers you with limited access near the US border if you're traveling. So you would definitely want to make sure that your plan covers you worldwide for your services. And in addition to that, I always recommend adding on some type of a travel policy as well. So I hope that answers your question. Thank you so much for that. And some of the other questions that we receive sometimes is, people who are new to Medicare, they're trying to find out what type of plan they need, because there's so many different options, either going with original Medicare, adding on a standalone plan, or adding on a supplement, or just simply enrolling in a Medicare Advantage plan. The one thing that I want to note that comes up a lot is that people have the misconception, or beneficiaries, that they can have multiple of these plans stacked on top of each other. And some of them are not able to work with each other. So if you choose a Medicare supplement, you are not able to also choose a Medicare Advantage plan. But if you have specific questions about that, please call one of the phone numbers that Ann provided to you, and we can go into more detail about your specific situation. But some of the things that you want to start off with, we call at Blue Cross the 3 Ps. So you want to start off with checking your prescriptions and your pharmacy. benefits. You want to make sure that all of your prescriptions are covered. And then you also want to know what your cost is going to be up front, because none of us want to get caught at the counter with unexpected costs that we're not, of course, ready to, to pay for. And then you also want to check your providers, because for me, I've been with my doctor for a long time and I don't want to change. So you definitely want to make sure that your doctors are in the network and that you have that access to care. The next thing you want to look at is plan value. You want to see what all the little extra goodies, or what we call here in Louisiana is lagniappe. You want to make sure that it has those things like, you know, the vision, the dental, fitness benefit. And one really good thing that people love this time is the over-the-counter benefit, as well as a telehealth service. These are some really good extra benefits that a lot of the Medicare Advantage plans do carry. Now, there are a few things that you want to look at when you are trying to look at a plan. In addition to those 3 Ps, you want to kind of maybe get with an agent or a broker like Ann and I, because as long as we've been doing this, we can kind of fill out the situations and be able to give you the advice. That's what we're here for as licensed agents here in Louisiana. So call one of the phone numbers if you're interested, and we can definitely go into detail about your particular situation. Now, if you already have a Medicare plan, those dates that Ann was talking about this coming October is the annual enrollment season. This is when you kind of want to go through your policy and make sure that it still fits, because of course things change from year to year. Your current benefits may change, or your particular situation may change. So you always want to get a refresher and make sure that you've chosen the best policy. And October the 15th through December the 7th is that time to do that. Now, I'm going to see if there's any other questions. It doesn't look like we have any yet in the chat, but a few other questions that I received is, you know, I decided I'm eligible for Medicare, let's just say for September the 1st, but I'm still working. I don't plan on taking my Social Security benefits, and I don't know how that affects my Medicare. Those are 2 separate things. It all is under the Social Security Administration. But when you decide to delay or receive your Social Security benefits, you can delay that at your discretion. But taking your Medicare at 65 will be completely different than actually accessing those benefits. You do not have to do them both at the same time if you don't want to. That's a question that I get a lot. Another question is, do I still continue to take my Part A and my Part B? If you're going to continue to work and stay on your employer group insurance, then you should have the possibility of waiving Part B. But again, I would always say to call one of the agents or brokers, and also touch base with your human resources department to find out if that's an option for you, because some employers do require you to take Part B. All right. And looks, I just got a question here. It says, do I automatically get my Part B? So it doesn't automatically happen. Now, if you are already drawing Social Security, then you will be eligible for Part A and Part B, and Medicare will automatically enroll you in that. Now, if you don't want them, you will need to sign the card and send it back. They're going to keep A because that's already been paid for if you've, worked enough quarters, and Part B can be waived if you decide to. Now, if you are not already drawing Social Security, you are not going to automatically be enrolled in Medicare. You will need to contact Social Security so that you can do that and enroll in Part A and B. And then at that time, you can decide if you want to waive Part B or not. And for that particular situation, I would advise that you talk to an expert to decide if it's a good situation for you to waive it at that point in your career. But again, it is not an automatic thing. Now, if you waive it, when you do decide to retire, or if something changes at work and you're coming off of those group and benefits, then you want to notify the Social Security Administration as soon as you can, because it does take time to process and for them to reinstate your Part B. And you want to do that so that you don't have a lapse in coverage, and you'll be able to pick right up with some new insurance once you do come off of your employer group insurance. All right, we got some good questions here. All right, and I turned 65 early in December. And what's my deadline for applying for Medicare? So there's something called ICEP, which is the Initial Coverage Election Period. This runs a span of 7 months. So it's going to start the 3 months prior to your birthday, which is going to be September, October, and November. And then you have the month of your birthday, which is December, and then the 3 months after, which is January, February, and March. You have the ability to enroll anytime during that time span without having to wait for the open enrollment period. Now, note that if you want your Medicare benefits and a plan, like a Medicare Advantage plan or a Medicare supplement, to begin on December the 1st, it's very important that you choose a plan and enroll in Medicare prior to the effective date. A lot of people think that if they enroll in December, it will be effective for December, but it needs to be in effect, or your application needs to be completed prior to the first of the date of the effective date. So in this case, you would need to enroll in something prior to November the 30th for a December the 1st effective date.
And one other thing as well. So you would also be able to get the benefits if you did a Medicare Advantage plan, for example. You would be able to get the benefits for 2021 for 1 month, and then you would have the new benefits for 2022 starting in January. So just to let you know that as well.
Right. So on that note, what Ann is speaking of is that at the beginning of the year, every year in January, companies release their new benefits. Sometimes there are slight changes. You may not see very many changes at all, but you will receive what's called an ANOC, also known as an annual notice of change. This is required to go out towards the end of September, early October. But the reason for that is because they want to get it into the members or beneficiaries' hands prior to the open annual enrollment period, which starts on October the 15th, so that you can kind of do that research. So going back to that note, definitely look out for that if you're already on a Medicare plan, so that you can review that. And then if the changes happen, what Ann was speaking of is that if you're effective in December, when you enroll in December, I would automatically ask them what the benefits are for January, because they will be released. That way you'll automatically know when you're making the choice for both time periods. Good question, Ann. Good answer, Ann. And do you have any other questions that you frequently get that you'd like to discuss?
No, that's some really, great questions. I like that Deborah hit on, checking the 3 Ps. That's a lot of, great questions that we always get about the pharmacy, the provider. And somebody's asking about the Advantage plan. So, the difference between, like Deborah was saying, the Advantage and the supplement plan, our Advantage plans are more of like a comprehensive plan. So like Deborah touched on before, that's where you're going to get your medical, you're going to get your prescription in there, you're going to get those little extra benefits. So you get dental, you may get your eye care, your vision, you get hearing, fitness. So you get a little extra additives. And then like Deborah was saying, with the supplementals, you have to add on those things. They don't automatically come in the plan. So you'll have to add on a prescription plan if you want dental in there, if you want vision, so they don't automatically come in a supplemental plan. So that's the difference between an Advantage. That's some differences. And then you want to check to see, when you look at an Advantage plan, if your doctors are in network, so the providers are in that network as well. So you want to check those kind of things as well with your
Absolutely.
agent.
And one good thing too, Ann, I'm sorry, I want to make sure to point out is sometimes people get confused about the administration of an Advantage plan. So one thing to note is that people ask, will a Medicare Advantage plan replace or eliminate my Medicare? So it doesn't necessarily replace it. It essentially is the private insurance company doing the job for Medicare, but you do not lose your Medicare. Medicare stays in place. The only difference is that you don't have to use the card when you go to the doctor, because all of the bills will go to the Medicare Advantage company. And that's a question that I get a lot. They don't understand how that works. And on the back office side of it, it just means that your Medicare Advantage plan administers the benefits for your Medicare and does the job for Medicare. And with a Medicare supplement, you have multiple people doing the job. You have Medicare doing a portion, and then you have your supplement doing the portion. So that's another way to understand how a Medicare Advantage plan works.
Great.
Yes. All right. So it looks like no other questions just yet. If you didn't have anything else to add, and we're coming, looks like nearly to the end of our time now. And we did get a chance to share some good information. But if there's questions that, you don't feel comfortable putting in the text, or it's more of a personalized situation, please reach out to us. Again, my name is Deborah Smith. This is Ann Booth. We are both Medicare benefit specialists for Blue Cross. This is what we do all day. And I love it so much, I'd probably do it even if Blue Cross didn't hire me to do it. But we definitely hope that you have learned something today. Please add comments and let us know what you think, or if you have any additional questions. Now, I want to thank Ann definitely for joining me today and adding in her information and sharing her tips as well. It looks like we did get one more question here before we wrap up. It says, I turned 65 in January of 2023. When should I start talking with an agent? So in January of 2023, I would probably say mid 2022, maybe around the spring or summer. We usually start to talk with our beneficiaries about a year out, but sometimes you can just get preliminary information about the basics of Medicare, but I probably would start about six months out or so. Would you agree, Ann?
Yes, I think that would be a great time. Definitely.
And the reason why I say that for a January effective is for the same point that Ann touched on, is that you have those new benefits coming in. So you'll be able to get the structure and the outline of the information and at least get a good understanding of it, but you definitely want to follow back up closer to your effective date so that you can get the new information for 2023.
That's right. Yes, I agree with you there. Yeah.
All right, so we definitely want you guys to follow our YouTube channel and share the link with your friends and family. Anyone that you think can benefit from this information, please share our phone number. This is what we're here for. And you can also find past posts of our previous Facebook Lives on there as well. And I want to note really quickly before we wrap up that our next Medicare Made Easy is scheduled for Tuesday, September the 21st. And we also have more broadcasts coming on October the 26th and November the 16th. Let's see. And we will be dropping that information about those upcoming Facebook Live events in our comments shortly here.
Yes.
All right. And then, of course, we do want to touch on the vaccine, COVID vaccine. If you have not already received your shot, please go out and do that. And if you have any questions about it, you can drop those in the comments as well. Any feedback from you, Ann, on that?
I was just going to say, we'll be having a Facebook Live information on the COVID vaccine with some of our clinical staff. So that way, if you want to log on, you can, ask them any questions that you have, and they'll be more than happy to help with that information. So we will have that on our Facebook page as well. But I think it was all great questions, and you can reach out to us again at 1-800-568-1417, or TTY users, it's 711. Or you can visit us at bcbslaplan.com/Medicare. So we appreciate you all. And thank you, Deborah, for all the good information as well. I enjoyed it.
Same to you, Ann. Thank you. Thank you so much. And thank you all of our Facebook Live and Blue Cross and Blue Shield attendees. We really appreciate you joining us today. And again, if you have any questions at all, please feel free to reach out to us. And you guys enjoy the rest of your day. Bye now.
Bye. Thank you.
Thank you.